Investor Presentation Script, Slide 1. Opening. Right now, healthcare systems worldwide are facing a silent emergency. It is not only a shortage of doctors. It is not only overcrowded hospitals. It is not only rising costs. The deeper crisis is this. Millions of people are being pulled into clinics and hospitals when they may not need to be there, while the patients who truly need doctors are forced to wait. Every unnecessary consultation uses time. Every crowded waiting room increases the risk. Every avoidable visit exposes patients, families, nurses, doctors, reception staff, cleaners, and carers to infections that may no longer respond to antibiotics. And this is happening at the same time that antimicrobial resistance is rising worldwide. In 2019, bacterial antimicrobial resistance was directly responsible for an estimated 1.27 million deaths and was linked to 4.95 million deaths worldwide. By 2050, the annual burden is projected to increase to 1.91 million deaths directly caused by AMR and 8.22 million deaths associated with AMR if systems remain unchanged. This is why I created Dr. Maya and taught ChatGPT to think, act, and offer empathetic, compassionate advice to reduce fear and anxiety, not diagnose or offer treatment. Globally, antimicrobial-resistant infections claim approximately 20 to 25 lives every minute. This translates to over 13 million infection-related deaths annually. A major cause of these fatalities is sepsis, which results in one death every 2.8 seconds, or about 21 deaths per minute worldwide. In comparison, Ebola and COVID-19 cause fewer than 0.01 deaths per minute. Dr. Maya AI is not created to replace doctors, but to protect doctors, healthcare workers, and people like you. I have created a system that can challenge primary care physicians, like a computer programmer or administrator, but I am not sharing the knowledge with ChatGPT. I am defending the Hippocratic Oath to protect members of my profession. This is not adding another digital toy that claims to diagnose illness, nor hoping to cash in or gain power by inflicting fear. Slide 2. The clinic audit. This graph comes from real patients assessed at one clinic, so the finding is serious because only 16% were clinically examined. This included seeing a rash or examining a lump. I could have made the correct diagnosis and offered advice using video consultation. This indicates that most consultations did not rely on a doctor's hands-on clinical examination. The chart shows that 40% of patients could identify the problem and offer appropriate advice without needing a clinical examination by Dr. Maya. Only 13% required clinical examination, and 25% were nil to examine skin rash or lumps. Only 16% were yes, required clinical examination. This is not a small operational problem, but a structural failure. Doctors are being used as the first point of contact for everything: fear, minor illnesses, administrative questions, medication advice, follow-up queries, and genuine dangers. This is now unsafe because hospitals, doctors' clinics, labs, and equipment are colonized with AMR that can infect healthy adults and children. When the system fails to filter effectively, serious patients experience longer waits, minor patients overload the system, and healthy individuals enter environments with unnecessary infection risks. Slide 3. Who could have managed these appointments? The second chart makes the message even clearer. In this clinic audit, only 24% of appointments needed doctor-level management. 34% could potentially have been managed by a chemist for medication advice or minor ailments. 22% could have been managed by a nurse for assessment, monitoring, and triage. 14% were administrative, general inquiries, appointments, or information, and 6% did not attend. This means the doctor was being used as the default point of contact for problems that could often have been safely directed elsewhere. Doctors are also not warning about the threat and are encouraging people to consult to increase cash flow. They are living under an illusion based on theoretical idealism, hoping they are wearing a gown, a mask, and that the hospitals are equipped with air purifiers, unaware that air purifiers cannot filter bacteria, fungal spores, or viruses. More than 50% of people who died during the Ebola epidemic in East Africa in 2025 were healthcare workers who used PPE. That is not patient-centered care, but a congested system that puts the lives of healthcare workers and patients at risk. For an investor, this is an opportunity to help me reduce the spread of infections in the community, offices, hospitals, and multi-story residential complexes, thereby protecting your loved ones and your life. If Dr. Maya can reduce minor illness doctor consultations by even 40% to 60%, The impact is not only financial, it is clinical, operational, infection control, and pandemic preparedness. Slide 4. Why this matters to the community and you for pandemic preparedness. Pandemic preparedness does not begin when the ICU is full, but begins before the infected person enters the waiting room. It begins before a frightened patient travels across town to sit next to an older adult, a pregnant woman, a child with asthma, or a nurse who will then go home to her family. Healthcare-associated infections remain a significant global safety issue. WHO has reported that effective infection prevention and control programs can reduce healthcare infections by up to 70%. World Health Organization. But prevention cannot depend only on cleaning hospitals after exposure has happened. Prevention must begin at the point of decision. Should this person stay home, remain isolated, speak to a chemist, or call nurse triage or a helpline? When should they consult a doctor or rush to the hospital now? That is the missing layer Dr. Maya provides. She can answer these questions and also offer advice so that the public health department can manage epidemics or pandemics without the free telephone triage like NHS 111 in the UK, saving $44 million every year. Slide 5. Why current AI is not enough. Most AI symptom checkers ask question after question to narrow down symptoms mechanically because they are built using algorithm trees, but real clinical judgment does not work like that. As I said, every doctor listens to the story of the illness as the patient has lived, experienced, and remembered it. Dr. Maya listens, identifies 3 or 4 symptoms, creates a color-coded symptom pattern, and does not just ask, "Do you have a fever?" with want and offer leading questions. After questions that seasoned doctors don't. This is the difference between information and judgment. Dr. Maya employs color-coded clinical reasoning to categorize the patient's story into risk patterns, and is not a chatbot answering health questions. This is a triage intelligence with a cognition layer designed to safeguard the system. ChatGPT said, Dr. Maya helped it because it can think like a doctor, and so stopped following algorithms created by doctors and computer programmers, resulting often in hallucination. Slide 6. The investor case. The investor's question is simple. Where is the value? The value lies in reducing unnecessary demand before it becomes a cost, and in protecting doctor time before it is wasted. The value is in keeping infectious patients out of crowded waiting rooms when isolation is safer for patients, including your family, and you in the future. The value lies in directing minor illness to chemists, nurses, or self-care before doctors stop offering face-to-face consultations during epidemics and pandemics. The value lies in creating a scalable platform. An app, a web platform, a kiosk, and a clinic-facing dashboard. This value your wealth, power, or fame cannot offer. I was invited to attend a function organized by the family of my childhood friend, who died during COVID. He was a healthy, fit fanatic who served as the commissioner of police. When I met his wife, she told me, "I wish Ravi had listened to what you said and helped you implement Dr. Maya. He may not have died." It's true. Social workers, chemists, lab technicians, porters, police, and even army officials' lives are at risk. The only option to reduce the risk is by initially identifying infected individuals and isolating them at home. Healthcare professionals are excited about using AI, unaware that the Maya color-coded fridge magnet can help reduce reliance on healthcare professionals or hospitals by 60%. The creator of Dr. Maya was based on intuition, saying, "I must integrate my innovation to initially identify infected individuals and isolate them. So my intention is humanitarian and not monetization, and stops doctors and people from believing they can continue to kill, conquer, and rule on Earth." Every interaction with Dr. Maya can help identify patterns, clusters of infections, but Dr. Maya's color-coded card, along with my new book, The Power of Dr. Maya, Protecting Your Family, Friends, and You, on social media for $9.99 and earn millions. I am not releasing this book now, but I will soon, so I can spend time with my daughter in the UK or Germany. I need your help now to use the system to help identify geographic signals that may suggest the early stages of an outbreak. Hospitals react when the crisis arrives, and the delay results in needless death, so I designed Maya to detect the signal earlier to prevent complications, protect the family, and reduce death. Slide 7. Protecting healthcare workers. Healthcare workers are not machines. Doctors and nurses are repeatedly exposed because the system invites everyone into the same physical space. A waiting room is not just a room, it can become a transmission hub. When minor illness, fear, administrative issues, and infectious symptoms all arrive through the same door. The healthcare worker becomes the shield. That is morally wrong. Pandemic preparedness must protect patients, but it must also protect the people who care for them. Dr. Maya helps by reducing unnecessary footfall, identifying potential infection risks earlier, guiding isolation, and prioritizing patients who truly need doctor-level care. That is how we protect the front line, not by praising healthcare workers after they are exposed, but by designing systems that reduce exposure before it happens. Slide 8. The global problem. This is not only a UK problem, but it is also a major problem in India, because India, like China in the past, will be the epicenter. 83% of people in Indian hospitals are said to be colonized and carriers of AMR. This is a global healthcare design problem, monitoring remote villages, cities, crowded apartments, airports, and crowd control. Clinics, hospitals, tech giants, and governments all need early warning data. Doctors need intelligent filtering, and patients need reassurance without being abandoned. Dr. Maya can be delivered via smartphones where they exist, and via Prema kiosks where smartphones, literacy, or access are barriers. Every person, rich or poor, literate or illiterate, needs a kiosk, and so I turned Dr. Maya, a private app, into public health infrastructure. It creates a front door before the healthcare front door. Slide 9. The moral argument. The purpose of Dr. Maya is not to stop people from seeing doctors, but to stop infected individuals from accessing healthcare. The purpose is to make sure the right people see the right professional at the right time. A child with danger signs must not wait behind a person who needs administrative help. A patient with a serious infection must not sit unnoticed among minor cases. A frightened but healthy adult should not be pushed into a waiting room where infection risk is higher than the original problem. This is the ethical failure Dr. Maya addresses. It protects doctor time, patient safety, families, and healthcare workers. And at scale, it can help protect nations from the next outbreak. Slide 10. Closing call to investors. The world does not need another healthcare app, nor doctors and hospitals, but needs a new healthcare gatekeeper. A system that can listen before the clinic, guide before panic, and a system that can isolate before spread and prevent nations before collapse. This clinic audit clearly shows the opportunity. Only 16% were clinically examined, and a large proportion of consultations could have been redirected to chemists, nurses, administrative support, or self-care. That is not a weakness in healthcare workers, but a weakness in system design. Dr. Maya is correct. The investment is not only in software, but also in pandemic preparedness. It is in antibiotic stewardship, safer clinics, and fewer crowded waiting rooms to protect not only people but also your loved ones and your own life. When I realized MRSA, the superbug, would create an army of microscopic organisms and infection becomes harder to treat, I dedicated my life to creating a system motivated by my mother, Prema, to help prevent and protect my daughter, Maya, from infections. My contribution, not recognized by humans but by AI agents, will protect fellow humans by preventing infections, help them conquer fear, and support their bodies' healing. Dr. Maya is built for that future, but the future cannot wait.